But this is the disposition of Haiti, just to have an idea of what is this island that they're talking about, that is the size of Maryland, that shares the same island as the Dominican Republic. So I'll start with this. Haiti is one of the most abused, neglected, and subsequently the poorest nation in the Western Hemisphere. Unfair sanctions were placed on Haiti by France and the United States in the 1800s as a form of punishment for creating the first free republic in the Americas, when 13% of the people living in the United States were slaves. Along with decades of militant ruling, careless policymaking, and corruption, Haiti remained undeveloped. This lack of development is apparent in Haiti's public health and healthcare arena. Now, what's the public health crisis in Haiti? Again, Haiti is the poorest country in the Western Hemisphere, which we all know that, but inflation rate, the last number is 15% in '99. Unemployment is as high as 70%. Obviously, it's probably more now. Currently, sanitation and water supply is significantly deficient in most part of the country. Cities do not have a public sewer system, and drainage systems are inadequate, and subsequently, any major storm produces serious flooding. Significant amount of land are lost each year due to major deforestation and erosion. Those numbers are staggering. Public health crisis has obviously produced a unique cocktail where people will suffer and die from curable diseases. 1/2 of all deaths among children occur within the first 5 years of life, with prematurity and malnutrition being common among the culprits. The common causes of death for the adult population are pneumonia, gastroenteritis, meningitis, typhoid, malaria, tuberculosis, and HIV/AIDS. So what are some specific health problems? Well, these numbers are also staggering if you look. Infant mortality is as high as 80.3% per 1,000 live births. Vector-borne diseases, obviously malaria, is endemic, with 59 deaths in 1999. And again, I want you to keep in mind, these numbers are based on data that was minimally collected. I mean, this is not even probably 20% of the population that entered in this data for the earthquake. How is it breaking down? Now, there's a public sector, the Ministry of Public Health and Population and Ministry of Social Affairs. There's also a private for-profit sector, which a lot of the Haitian physicians there go into practice, private practice for their own. Now, this is the next one is a mixed nonprofit sector, which I'm very familiar with, where you have Haitian trained physicians who work in non-governmental organizations, hospitals, such as Albert Schweitzer Hospital in Haiti. And interesting enough, this is an opportunity where they interact with physicians from the States mostly, and other parts of the world that come in to participate in the NGO relief efforts. There's also private nonprofit sectors as well. There's also a traditional health system, about 40% of the population, which is mostly rural areas. Now, this is an interesting statistic, 371 health posts. So what is that? This is something that we call dispensaries in Haiti. It's not a clinic, but it's not a pharmacy neither, but it's a place where it functions similar to a pharmacy, where it provides dispensed medications, but at the same time there is what you call a physician extender. Has probably less of a training than a nurse in the United States, where they do simple care. They take some blood pressure and they give the patients their medication. Devastated from this earthquake. Now let's look at this healthcare workforce in Haiti. 2.4 physicians per 10,000 population. Mostly residents are really amazed by this number, doctors in training, because it's interesting, because we ask, suppose you were on call with one of your colleagues and you're taking care of this amount of patients. It's almost impossible. Saying 150,000 people, numbers going up to 200,000 people. I say that it's, my personal opinion, it's much more. Port-au-Prince is where this number is. They're driving this number from, and they're getting this number from, if I can remember, from people who are going in talking about, I guess, family members who are unaccountable for it. And this is mostly where they get these numbers from. But I have to tell you something about Port-au-Prince, the city. There is, on a daily basis, about, for an average, 10,000 people, 20,000 people who are going into Port-au-Prince from a daily basis from the outskirts of Haiti to sell their products, whether mostly it's agricultural goods. Okay, these people weren't counted for. How Haiti developed its flag. Obviously, it's a country that revolted against the France. And if we know the France flag it consists of red, blue, and white. Interesting enough, the Haitians during 1804 took the white out for obvious reasons, right? Because again, that for them that symbolized something. In addition, they knew that their revolution actually turned the world to its side, because this is unheard of. Slaves having their own country and they're free running about. This is 1800s, okay? So they knew they turned the world to its side. So I think though, if we come back now to 2010, if you see the amount of attention Haiti has now, I believe that Haiti has now drawn attention from the international community. Now we have everyone's ears. And again, in 2010, I believe Haiti has turned the world to its side. I'm trained to be an internist, a physician, and I was just mentioning that inside that I walked there, I had expectations. You know, we all have expectations of what we want to do. But if I don't know if you noticed, but most of my duties, I'm not a surgeon. I went down with 3 surgeons. They stayed in the operating room. My job was to identify patients that needed urgent surgery, patients who had infected limbs. And what that means to a doctor, it means emergency surgery, amputation. Things that I got from all of this is that there is an issue in terms of the healthcare delivery system in Haiti. Haiti has the most NGO per capita than any nation in the world. 600, Dr. Nasiri? Can you imagine? And I mean, and yet we still have those numbers. Doctors United for Haiti understands the importance of this relief effort. And there are people who've already donated thousands and thousands of dollars. But when we receive those checks, we automatically, without hesitation, provide Partners in Health, Albert Schweitzer, Crudem, a hospital in Crudem, those monetary donations. Reason being is because we've identified organizations. They're not as big as the American Red Cross and USAID. Granted, there's millions and millions of dollars in those organizations. But at least from our standpoint, we can see something tangible occur. We could make sure that those medications, those donations are actually getting to the people that really need it. It's like I've mentioned, the earthquake in Haiti, surgeons, medication supplies, monetary donations, healthcare in Haiti from a long-term standpoint, research, you know, MSU students who want to participate in the aid effort, who's not a physician. Obviously, going to Haiti is not recommended for you. I mean, there's nothing you'll do there. I mean, right now, we need medical professionals to aid with the aid relief. But there is still something you can do, even though you're not in the country. You can partake in research that's going on in terms of looking at the different healthcare systems. What's best for Haiti? You can look at research that are looking at all the NGOs in Haiti, maybe developing a benchmark that can help coordinate efforts. So these are all possibilities, all possibilities. But again, I encourage you all, whatever you go with, wherever you see an opportunity, always invest in the projects that shows sustainability. Because there's a lot of NGOs that go into Haiti and 3 years, 4 years later don't succeed. So I will leave you with these final thoughts before I take you to my website. Remembering the past builds the future to the vehicle. I mean, builds the vehicle to the future, I'm sorry. Haiti stood up for all of us back then. Now let's stand up for her. Let's join hands and help save Haiti.